physician chiropractor, Dr. Gregory Johnson, and today we have Gina, who was referred in to us by a fellow co-worker here in the building, and Gina has had some cramping and pain in her toes, which is quite uncomfortable, especially at night sleeping, huh? So we're going to show you how we deal with feet problems and toe cramping or plantar fasciitis if you have that. So let's face the mirror first. And Gina, I'm going to have you do the same thing we always do. Close your eyes and flex your head forward and backwards. Good. Range of motion's good. Now stop at neutral. Back to neutral. Yeah. And we always analyze the patient's posture three-dimensionally on the x-axis, the y-axis, and the z-axis on every single visit. So we can monitor the patient's progress and determine what their true standing weight-bearing biomechanics look like, or their alignment. Because posture is a mirror of a spinal biomechanics. So she's got just a little bit of pelvic rotation. That's probably from sleeping on her side.
Yep.
See, people know whenever you point these things out to them, and then they start paying attention to them more, and they even help themselves get well even quicker. And Gina's done real good. This is only her third visit, so okay, Gina. So first thing we're going to do is I'm going to decompress you today.
Okay.
Let's lay on your back.
Okay.
Now this is Gina's first decompression, isn't it?
I've heard about it.
Just
Yep.
slide down this way just a little bit. So it's always interesting to do a live video on a first time decompression. Now this will be, I'm just going to put this towel around your occiput, which your base of your skull. And there we go. I'll bring our legs up. You just want to bring the legs up too to where they're parallel with the floor, because that changes the angle in the pelvis and relaxes the lumbo-pelvic muscles as well as all the spinal muscles, cervical, thoracic, and lumbar. There we go. Yeah. Nice deep breath through your nose. Keep your teeth together and just relax. There it is. Very good. You feel that all the way through?
Mm-hmm.
Yep, very good. She did good on that very first one. And look there, she's still kicking. Okay, now.
I've been warned about that one.
Yeah, she heard all about that from her coworkers who referred her here. And also the turbinator, which I've yet to use on her. But today might not be a bad day for their foot cramping. Oh, let me just go ahead and do these while we're up here, and feet's up in my range a little bit better. I don't have to. Now we always suggest the arch. Now, did you feel that? That was the lateral
I'm very flat-footed.
part of her tarsal. She was flat-footed, so what we need to do is help her get these arches back. And then you notice we adjust each one of the phalanges of the toes. And you can probably hear those all the way over there on the camera. And I just got my adjustment here about 5 minutes ago, so I'm really feeling my spunk today. Very good. Now, always see that sore right there, isn't it?
Mm-hmm.
Very, very tender on the plantar surface of the foot, which is the plantar fasciitis, right there. And just put a deep, steady pressure in there, and that helps those. Now, we always want to work on the tibialis anterior when we do that too, and I'm doing a technique known as the Golgi tendon apparatus, where you get right in the belly of the muscle and you deep pinch it together like that. You trick the muscle spindle and Golgi tendon apparatus to think that it's contracting, so then it relaxes. Very good. Okay, now we're going to let her down. You did really good on your first one.
Didn't hurt.
Yeah.
I mean, I've heard stories about it and know it was
Well, we've
not
heard
that
all
bad.
kinds of words about on that table, believe me. It just pop out of people's mouths. Okay, let's roll you on your side and come over here on your tummy.
Okay.
There we go. Legs are even now. That's a good start. Still tightens up just a little bit down the low back there, but not too bad actually. So she's got a little bit of pelvic distortion, which we're going to adjust the left sacroiliac first, and then the right one on the x-axis and the z-axis. Now the sacrum, we're driving straight down away from L5. There's L5, L4, L3, L2 and L1. We get those all the way up to L1 on that. And want the patient just to breathe normal on this one and just relax. That's easier said than done for some. Yeah. Now she's still got quite a bit of paravertebral muscle hypertonicity here in this mid-thoracic region, but she sits all day working at a computer in a very important position in one of the companies that we take care of a lot of their people here in this building. Okay. Very good. Okay, yeah. Okay, Gina, this is going to be the first time you've had this. It's called Turbonator. What we're doing is we're getting right in the belly of the plantar fascia on the calf. You can use the pretty finger. And move all the way up into the pelvic musculature. Lessons work. You know what, the left is fine. This Turbonator is custom made from a Black & Decker jigsaw is probably one of the best myofascial release tools that you can use to break down adverse adhesions, scar tissue that are in the fascia, the coverings of the muscles. And then we always try to leave them with a better feeling, so I use this deep percussion vibrator, which you can get on, where do you get these, Renee?
Amazon.
Amazon, yeah. And it's called the Genie Rub, so we actually do. This is one of the things that you can do at home, but I would not advise doing any of those other things to your friends or family members unless you're a licensed chiropractor. This is one of those things where you don't try this at home, but this particular device you can use at home because it's pretty safe for anyone. It helps to have a person who knows how to drive it. There we go. Very good. Now she has gotten absolutely excellent movement so far in every part of her spine. Nope, not that way. Okay, let's turn you on your back for me. Now, you notice from watching our treatment videos that we don't do a bunch of modalities or therapies here in the office, but we do occasionally when a patient's had chronic pain or conditions for a long time. We do write prescriptions for a TENS unit, or Trans Electrical Nerve Stimulation Unit, which is basically electrical muscle stim. See, we get back down there on our feet, make sure they're doing okay again. Very good. Now, let's turn you back on your tummy, Gina, and I'm going to fit you with this TENS unit. And we get these TENS units from a company out of Tampa, Florida, known as Preferred Physician Solutions, and their number is 888-811-TENS, T-E-N-S. So if your chiropractor determines that you need a good tinge in it, this would be the place to get it at Preferred Physician Solutions out of Tampa, Florida. So you can see it's a very compact unit, so a lot of our patients wear this while they're working in their jobs. I'm going to put this right up here for you to hold on to, Gina.
Okay.
I'll just put it right there for the moment.
Okay.
And you notice how it has a left lead and a right lead, and on the left lead and right lead we have red and black pads. So we're going to put this black pad not on the spine, the bones itself, but the muscles right along the spine there. So this is paravertebral, meaning beside the spine and the muscles. Now on the corresponding left lead, we put a red one directly across from the black lead. And then on the opposite side, we crisscross the lead. So we got a red lead here and a red lead here. And then we crisscross this again so that this black lead is exactly opposite or catty-corner from this other black lead. That gives us a figure 8 or infinity type of circulation. So then we teach the patients just how to operate this. So you want to just turn that till it clicks on.
Okay. Both sides?
Yeah.
At the same time?
Yeah, and then you'll start feeling it. Don't turn them up too quick. Yeah, it's
Ooh.
very powerful.
Mm-hmm.
Yeah, now turn it up to your maximum level of tolerance. Now, what this does is I've got this set on continuous pulse, and it will fatigue the muscles, and then they'll relax, but it also blocks that pain message that goes up through the lateral spinal thalamic tract into the brain, so it blocks pain signals as well. It even does more than that too. It influxes blood and nutrition into the area by increasing circulation, so it helps it heal quicker. Okay, so let's go ahead and have you stand up here, and I'll hold that for you. And then you can just clip that right on your pocket or the side of your pants.
Okay.
Now this is something patients wear throughout their workday, whether they're sitting or standing. And now we're going to come over here and shoot her. So we
You can't even see it, really.
Yes, that's right. So we're going to set this at the right settings for her. There we go. Now, we're going to check her posture again. Let's flex you forward and backwards. There we go. Neutral. Good. Now, she's still got a little bit of forward head posture and turning to the right. Pelvis is right down the center now. So here's her home therapeutic exercise. We have the patients lift up with their traps, back with their rhomboids, and then she's got we're going to flare the hands towards the front, and that really tightens this whole area up. Now we're going to bring her head straight back. Because she was turned to the right, we're going to do exactly opposite of that. Go left. This is called mirror image adjusting with the cervical instrument that adjusts C1 on the x-axis. Now you can relax. Okay, now let's have you flex your head forward and backwards again to make this feel smoother.
Mm-hmm. Yes.
You got much better range of motion. The only thing I'm still seeing is that rotation. So let's open your eyes.
Okay.
See how you twisted, right?
Mm-hmm.
So we're going to do that same thing again. And we're going to twist her even more. And then I'm just going to hit the atlas there, stimulating that. There we go. Neurological information. You can relax.
Okay.
And let's go forward and backwards again. This should feel the smoothest of all of them.
Mm-hmm.
And now, see her head straight now. Right down the gut. Shoulders are level. Pelvis is right in the center. And she's wired for trans-electrical nerve stimulation. And thank you very much, Gina, for letting us use you today and show the people out on our YouTube channel what we do with you. And can you tell them what your experience has been here so far?
It's been great. I've been having I thought it was
pain.
and it seems to have helped quite a bit.
By adjusting her sacroiliac joints in her legs, in her feet, everything. So we're full spine, full body type of chiropractor here in Houston. And this is your Houston chiropractor. We'll see you next time.